Hi, I'm Dr. Divyashree, consultant urologist, laparoscopic and robotic surgeon, and transplant surgeon at Sparsh Infantry Road. Today, let's discuss a few basic things about BPH.
What is benign prostate hyperplasia?
BPH or benign prostatic hyperplasia is nothing but enlargement of the prostate gland and a non cancerous enlargement, which usually causes difficulty in urination. Prostate is a male organ which is sitting below the bladder and surrounding the urethra, and as age progresses, it increases in size and can cause the different symptoms of BPH, that is, difficulty in urination.
What are the common symptoms associated with this disorder?
So, the common symptoms associated with benign prostatic hyperplasia is decreased urinary stream. Patient complains of increased frequency. Patient feels like passing urine again and again. The daytime frequency may get increased, and nighttime frequency or nocturia also happens. So patient wakes up more than once to void in the night. So these symptoms are usually caused by an enlargement of the prostate, which presses onto the urinary passage, and therefore it blocks the urinary passage, and patient has increased urine retaining in the bladder, which causes all these symptoms. It is usually caused by an increase in testosterone levels or a family history of BPH or obesity, sedentary lifestyles, or diabetes mellitus.
How common is benign prostatic hyperplasia in India?
BPH is a very common disorder. It affects nearly one third of the men over 60 years of age and 50% of the men over 80 years of age. Nearly 18 lakh men are affected with BPH in India alone.
How is the quality of life affected in patients with benign prostatic hyperplasia?
Patients with BPH usually present with different symptoms of decreased urinary stream, increased frequency, and sometimes retention of urine. And this affects the quality of life severely. It is a major health burden because, unlike prostate malignancies, in BPH, patient has daily urination which is affected, inconvenient urinary habits, increased bladder dysfunction in severe cases where bladder muscles fail to contract, and patient may require catheter due to the retention of urine, and in some cases it can also form recurrent stone formations in the bladder which needs surgical removal, and in most severe cases it can lead to kidney failure which may necessitate dialysis. So it is a very severe condition. It can affect daily living by affecting the patient from going out in public toilets and using the public facilities, and may affect his day to day living, his earnings, and eventually overall cause health burden. So, how do we treat this BPH? Usually, medications are the first line of treatment, which we give different medications which help to shrink the prostate size. And in severe cases, when medications are not improving the symptoms of the prostate, patient may require surgery in severe cases or intractable cases or in a large prostate gland. So the surgical procedures usually done TURP or transurethral resection of prostate or laser enucleation of prostate, and some newer procedures like urolift and RASM are also available. So please do consult your urologist rather than suffering in silence, and get treated at the earliest to have a good quality of life and a happy life. Happy bladder is happy life. Take care of yourself.